even now we see that despite the recommendations by a lot of doctors, there is still no clarity on whether the government will go for booster doses or not. It is still conducting a feasibility study. Then there will be reports. I know these things have to be done scientifically. There will be a report, and then the report will be studied, and then a decision will be taken, then the process will be rolled out. If the virus is 3 times more transmissible, should our speed of action not also be 3 times?
I'm really worried that you are actually putting together things which are in effect unrelated. What has become very obvious is getting the vaccine is not going to give you very good protection against the infection or transmission. For Omicron, that's fairly clear. So therefore, if we are going to use the vaccine or the booster for that matter as a means to stop progression, that's not going to work. Let me tell you a few numbers. One, data from the UK, the Imperial College put out a very beautiful document yesterday. I don't know how many people have had a chance to look at it very carefully. What has been shown is that people who had 2 doses of the vaccine are actually in good shape in terms of severity of illness. Second, although people who had passed COVID are equally likely to get COVID, maybe slightly higher than other people, than to get Omicron, severity is significantly less. So natural immunity in terms of preventing severe disease does seem to have some value. Hybrid immunity from the looks of it does seem to have value. So most of our people who got the vaccine 2 doses have all got it after getting the infection. And remember, 70% of India got the vaccine after getting the infection. My biggest concern is about healthcare workers. Why? Because the majority of healthcare workers got the vaccine before Delta hit us, and therefore they may not have had hybrid immunity, number one. Number two, they got the vaccine far ahead of everybody else, and therefore waning of immunity. And let's look at the data from Scotland and Brazil. In 4 to 5 months' time, 2 doses of Covishield, the AstraZeneca vaccine, there is significant waning of protection against severe disease. That's number 2. Number 3, this is important. If you look at what's happening with NHS in London, absenteeism of healthcare workers in the height of the COVID pandemic right now with Omicron is zooming because of COVID-related issues. If we don't protect your healthcare workers now, you're going to find a lot of people missing during the surge because they fall sick, right? So I think the time has come for us to stop debating and get the jab into healthcare workers immediately.
That's a very important point. Dr. Seth, I want to come to you now and ask you a question on these booster doses, that at least for the healthcare workers who were administered these vaccines in the first lot between January and March, should there be a provision where we should quickly start administering these vaccines, at least to the healthcare workers?
Yeah, absolutely. I think, Sanket, there's no doubt. I think Dr. Swaminathan expressed it clearly. We're not talking about boosters for the whole population, but there is no debate around boosters. Booster is with every vaccine and has to come at a particular time. The finesse is trying to time it correctly and for which group at what time. And I think it's very clear. Once we know the roadmap for a vaccination, and we know that at the moment there's surplus vaccination, we have the capacity, and we've created a roadmap for vaccination. There's no point actually staying back and not creating a roadmap for booster. We know how many people need it, we know which category needs it, and we know which time a person would need it. So I think it's very clear. There are 3 groups that we have to consider. There's no doubt and debate about the fact that there is this double vaccination, which is important in our own country, and that's the focus. But clearly, the ones who've actually got decreased immunity, we call it at the 3rd dose and don't even call it that a booster, those people who are on immunosuppressants or anti-cancer therapy, so on and so forth. There's this frontline for healthcare workers, very important group, which will actually take care of the whole population when the 3rd wave comes. And by the way, the 3rd wave is inevitable. And we therefore need to protect healthcare workers who are 10 months past their 2nd doses. And then there's going to be the elderly with comorbid. So we have to create a track. Actually, when we say, when is the time to give booster, the issue is not to whether booster or not. The issue is when's the right time with the data, with the vaccine availability, and with the equity is the right time. And certainly for this 3 subgroup of people, the time is right now.
No, but then,
I
but the reason why I want to ask you this question, Dr. Seth,
Please
is
go
that
ahead.
this feasibility study is going to begin now. Now, surely this could have been done a few weeks or a few months earlier. All this while we kept saying that, as a government, we kept saying that data suggests that it may not be feasible or it may not necessarily work.
So I think that relates to the whole population. Let's clearly say that we have a great confidence on NTAGI, we have great confidence on NEGVAC, but clearly this is this group that we're talking about. We're not talking about the whole population. And when the government has to actually decide, it's a fine balance with vaccine equity, availability, and therefore it's timing issue. Now, I'm sure that the experts are considering this very important issue as to which subgroups come in first.
Correct.
And then the whole population comes in later. So let's not put all that into a single bucket. And
Correct.
neither is the government saying that. They're actually saying where is the policy, and the roadmap needs to be what's there. It is not whether the whole country needs to
Fair
get
enough.
a booster, as many of the countries have done.
Fair enough.